Hey everyone, just wanted to do a quick presentation for you about some radiographic positioning with a few sort of comments and tips. So I've got a few radiographs here and I thought we'd just run through them and talk about what's good, what's bad, and maybe what's a little ugly. Well, there's nothing terribly ugly in here. So this first radiograph, so this is a radiograph of it shows the pelvis. So we've got this here, the hip bones, the pelvis bones here, and then the lumbar vertebrae coming down along here, and then the caudal or coccygeal vertebrae coming here. These two bones here are the femurs, obviously, attaching into the hips through the acetabulum, and then coming down to the stifle here. And what we can see here in the cranial part of the radiograph is the abdominal contents. So we've got some fecal matter that you can sort of see here. This is what this grainy kind of stuff is. And then some loops of intestine. So the black parts is where there's gas or air or liquid, and they're probably gas considering it's the intestines. And you can see sort of the loops of the intestine sitting there. So I've included this one. There's a few things about it. It's kind of at first glance hard to know what the focus is of this radiograph. So I think it's meant to be an abdominal radiograph, but the issue we've got here, there's a few issues, is that the abdomen, as you know, extends cranially and has a border cranially at the diaphragm. So you should be able to see the diaphragm in a radiograph of the abdomen. So I've got a good one further on that we can have a look at in a bit, but yeah, we can't see all of the abdominal contents here. On the cranial part is completely gone. Also, those hind legs are extended cranially, so they're bent forward. So the hips here are flexed forward, so they're potentially covering up or obscuring the muscle of those hind legs, because there'll be muscle all sitting around here. Is potentially obscuring something in the abdomen or not giving you a clear picture. So these should be extended caudally away from the dog, so stretching out behind them basically. What we also look for is that the hips are stacked on top of each other. So this isn't too bad. You want to essentially see the pelvis bones, the left and the right ilium stacked or superimposed over each other. So they're he's a little bit rotated, a little bit tilted, which is a female. You can tell from this radiograph there's a female. Yeah, it's a little bit rotated in one direction. But the biggest issue with this is it's kind of not really clear what the focus point is, because we can't see all of the abdomen. It doesn't look like it's all of the pelvis that we're trying to have a look at either. So this radiograph we've got here shows some vertebrae. So this again is lumbar vertebrae, and you can tell it's lumbar because they don't look like cervical vertebrae. There's no ribs attached to them, and this is, again, as we said, fecal matter. This grainy stuff here is feces. It's on its way heading south. So I've included this one. There's a couple of processing sort of errors. This is quite an old radiograph that was developed in a machine, and you can see these lines across here is dirt on the rollers, quite probably, that's scratched the surface. But most of our radiographs these days are digital anyway, so I think probably don't know if anyone's in a clinic with a manual processor now. But this one is included because they've got the lovely R marker here indicating it's the right side, and it's superimposed. It's sitting on top of the bones. So we really need to understand, when you're looking at the animal on the table, where the bones are and where there's soft tissue or fluff or fur, and that you don't want your marker superimposed over the bones, because again it could be obscuring something that you really need to see from here. This is also quite a specific, it's quite a narrow angle, so I'm not sure whether they were just intentionally looking at these 4 vertebral joints, but the collimation, which is the area that we've got radiographed, is a little bit odd as well. Potentially you would want to, if you're just looking at the vertebrae, you would want to finish the collimation a bit higher. You wouldn't want to include this lower portion of the radiograph. The smaller our collimation, or the smaller our area of radiograph, the more safe it is, because there's less x-rays, less radiation released. Oops. So these two radiographs are, the first one on the left, radiograph A, is the not so great one, and radiograph B is the better one, but there still could be a little bit of improvement. So the biggest problem with A is that this animal is really rotated. So when you're taking a radiograph and the animal's in lateral recumbency or lying on its side, you essentially want to visualize in your head a line splitting the animal in half from nose to tail. So it's got a left side and a right side, and you imagine a line going all the way down the middle of that animal. So it's got an equal side left and an equal side right. And then you want that line, if you then lie the animal on its side in lateral recumbency, you want that line to be parallel to the X-ray table. And that's your kind of guide. So what often happens when we put an animal on its side is, especially with some deep-chested dogs, is they'll flop. They'll tilt naturally downwards through their chest and their abdomen. So we get this rotation happening. And you can see it here on this one on A. This is the pelvis. So you can see it's really rotated. It's quite an oblique angle. And this one here, there's a little bit of rotation, like this ilium is not completely over the top of the other side of the ilium, and the femurs ideally will be stacked on top of each other as well. The acetabulum, which we can see here, is this joint here and that joint there, will ideally be stacked on top of each other. So you can use all sorts of positioning aids to help with this, things like your wedges, cotton wool, rolls of vet wrap, plastic bits of tubing, the inner cardboard tubes of a vet wrap, all sorts of stuff, anything that's not going to show up on an X-ray machine. But the common ones are those foam wedges and cotton wool, tape as well. So taping limbs to the table, obviously gently and not hyperflexing or hyperextending the leg, and just gently taping them to the table works really well, using things like masking tape so it's not going to be damaging to the skin or the tissue of the patient. So you can see on this abdominal radiograph that this one here on the left shows quite a different picture. I mean, this shows the same things, but it's not diagnostic. Like this one on the right here shows a more accurate picture of what's actually going on in the abdomen of the patient. And again, there's some fecal matter coming through here, and we can see some ribs hanging out here. And then this is our diaphragm cranially here. So in terms of our cranial collimation, that's pretty nicely done there. So just cranial of the diaphragm. And this radiograph here is a really lovely one of the shoulder joint. So when we're radiographing a joint, we want it to be bang in the middle of the image, just like this. So you need to be able to look through, imagine in the animal's body where that joint is. So you'll be palpating or feeling for things like the spine here of the scapula. So this is our scapula that you can see, that lovely big wing-shaped bone, and it's got a ridge that runs up pretty much up the middle of it, and it sticks out really fairly well, and you can feel it on most dogs unless they're really quite obese, but you would palpate for that and feel where the joint of the shoulder is. It's often in a different place to where people at first think it is. They tend to think it's more, for some reason, further away from the body. But this is great because you've got the shoulder joint right in the middle of the picture. We can see a bit of most of the scapula, and then about halfway down the humerus here as well. So yeah, really important to be able to imagine where these bones are underneath the animal's fur and skin. Other things, so we've got the cervical spine coming through here, and then the beginning of the thoracic spine. Thoracic vertebrae with some ribs coming off, and then this black tube here is the trachea, because it's filled with air, and it's always held open, remember, by those cartilaginous rings of tissue, so it always appears black. If this animal was intubated, you would actually be able to see the ET tube a little bit down through here as well. And this is another nice one of an elbow of a dog. So we've got, again, the joint, it's a radiograph of the joint. So we have the joint right in the middle. So we need to be able to palpate for things like this bit here. So this is called the olecranon process. So it's the bumpy bit of the elbow. So knowing where that is, and then being able to palpate the actual full feel for the joint. And then we would normally radiograph halfway up the humerus, and then halfway down the radius and ulna as well. So this is our ulnar bone here with the olecranon process at the end, the bumpy bit here, and this is our radius bone here. This here is a wee positioning aid. So it's actually a plastic positioning aid, and there's a radio opaque metal piece here, and then this is it's got a plastic head on it, so it's used to gently it can suction onto this particular one suctions onto the table, and then you can wiggle the end here and push it and get this elbow in the right position, because naturally this elbow would want to kind of fall backwards and collapse against the body a wee bit. And then we've just got our right marker here to show that it's the right elbow. And this radiograph here is of the abdomen. So this is they've used some contrast media here. So we can see this is a kidney here, and there's contrast media here traveling down the ureter that will go into the bladder, which is sitting around about here. So this is in terms of the position of the hips, so you can see they're pretty nicely stacked on top of each other. The femurs are almost stacked on top of each other. Picture we wanting to extend, and then the only thing with this probably is in terms of the cranial collimation, we can see quite a bit of the thoracic cavity here and the lung fields, which we probably don't need to see. So understanding what landmarks to look at for the cranial borders of the abdomen is important. So we could actually have cut off a bit of this radiograph cranially and actually caudally as well, because we've got quite a bit of the hind limbs here, unless they were particularly wanting, they may have been wanting, this is a female dog, so they may have actually been wanting to see if any contrast had travelled down through the urethra, so that may be why this has been included here. Yeah, don't know the exact circumstances. If that was the case, then yes, that would make sense that we would want to include where the bladder would be and potentially the urethra. But yeah, cranially we could have cropped off a little bit of this, but otherwise the animal's nicely stacked. You can see that these transverse processes, which are these bits here, the shadow bits, they're kind of overlaid. The left and the right transverse processes are pretty much stacked on top of each other, so there's not too much rotation through that spine. And then this is another one. This is also a study with some contrast media used. So this is a male dog. And we can tell it's male because it has a penis here, and then this here is actually the os penis bone. So male dogs have a wee bone in their penis, and so do wolves and things like that. But this is, yeah, something, a way you can tell that it's a male dog. But there's contrast media that's come down here through the urethra, and then this is the bladder of the dog here. So this again is beautifully stacked. See, like you can see the wings of the ilium are stacked one on top of each other really, really nicely. The femurs are really nicely stacked on top of each other. To get this, you would want to have something like a piece of foam or something between the stifles. Otherwise, you'll find that your top stifle will flop down and roll down and cause torsion or twisting through the pelvis here. Quite a lot of poo waiting to come out in this one. Yeah, but yeah, nicely sort of stacked up and positioned there. So the key to getting radiographs like this, as I said, is really just knowing those landmarks. So on the middle page, there's a good list of the landmarks that would be really good to be able to find and figure out if you can palpate those and find, you know, if someone says, oh, where's the olecranon process, you know how to feel, or where roughly it should be, or where's the greater trochanter, or where's the pubis bone, or the accessory carpal bone, or the ramus of the mandible, things like that, so that you can it'll help you picture what's going on underneath the skin and the other soft tissue of the animal. So you'll get really beautiful radiographs like this one.